Today we're going to look at the concept of pharmacology. In your textbook for Concepts for Nursing Practice, there is really not a concept per se. So we're going to kind of pull in a little mixture and look at things that have to do with pharmacology and look at our exemplars and the safety concerns when we come to the idea and the concept of pharmacology. Two of the main goals we're going to look at is how, about the term or the concept of pharmacology, but we're also going to identify safety in our nursing practice and in the healthcare profession. One of the main things I think about pharmacology and that concept is safety. What is going to be safe for my patient? How am I going to avoid injuries due to a medication, or how a medication is prescribed, or what is the medication going to do? What are the effects? So these are some things that I want to make sure that I think about when I hear that concept of pharmacology. So we want to definitely prevent errors, whether we're administering a medication or we're seeing the effects of a medication. And so this is part of our safety goals, and it is part of our practice every day. When I'm giving a medication, I have relationships with others and with equipment. So how I prescribe or put in an order for medication, the prescription, is it correct? Do I need to collaborate with the physician, the pharmacist, the patient? And also too, that human factor also involves everyday life. It gets very busy on the floors. So some of the things I need to think about is my work environment. Are my medications locked up safely? Do I have the correct lighting to look at my meds and make sure I'm administering them correctly? Am I handling the tools that I need? Am I in a hurry and I'm not really paying attention, and I'm not going through those steps to make sure that I am giving my medication to the correct patient, or giving the right med, the right route at the right time, to the right patient? Another thing that we want to think about is, can we also give medications in this environment that is become so complex and we use so much technology, and many times we just give a med without going back to the simple basics, is going back and looking at what is this med? What is it made of? What does it interact with? What are the effects of the med? What are the adverse or the side effects of the med? What do I need to teach my patient? Is this the right dose for this patient, considering their age, their body size, their body type, their medical history, any chronic illnesses? Let's say a medication is broken down in the liver and excreted through the kidney, and they have kidney disease, and they have a buildup of the medication, or it's not being able to be broken down. So these are things that we need to think about. The other thing is we need to make sure that we eliminate any issues. Again, checking with that patient. We're going to do 3 checks, and we're going to also identify that patient in 2 different ways to make sure we have that right medication and it's going to the right patient. No matter what area I'm working on, or if I get pulled into an area I'm not familiar with, I'm going to try to eliminate any errors. And one of the biggest errors that happens in healthcare profession, especially with nurses, is during the administration, and making sure that we understand about the medication we're giving and how it is going to be administered to that patient and what effects we need to be looking at. We've now have developed barcodes, and so we scan just like you do in the grocery store. We're going to scan those barcodes and make sure we have the right medication that pops up for that patient, and we make sure all of that matches. And then we have computer entry. Years ago, the scribble scrabble that these doctors had, we could not read their writing. We had to guess, and we had to guess the dosage. Now with computer entry, we don't have that problem. Everything is put in by computer. You can read, you can double check. And if you ever have a question, you go back and you call that physician or you call that pharmacist to make sure you do have the correct dose. Another thing that we want to make sure is that we have standard practices on how we give those medications, and you go through those steps. Don't try to make shortcuts, because that is where you're going to get in trouble. Everyone should be able to give meds, no matter what area you're in, where you float to, what practice, what setting, if even it's home health. Medications are given in a certain way at all times. No matter where you are, you can always give those meds as long as you know the standards. The last thing on this slide is talking about decreasing your distractions and interruptions. Have you ever been doing something or doing a recipe and then you think back, oh shoot, did I put the sugar in or did I not? Or did I grab the sugar or did I grab the salt? It can really make a difference in what it is that you're making. Same thing with our medications. Don't stop what you're doing. Don't get distracted. You stay focused. Errors can happen at the slightest little bit of a distraction, or if you get interrupted and you go back and say, oh, did I draw up that med? Was that the correct one I drew up? If there's any doubt, you're going to have to go ahead and waste that, and that's a cost that adds up in the end. So make sure that you decrease any distractions and interruptions any time that we're dealing with medications and the correct dosage and administration of a medicine. We have 3 exemplars that we're going to talk about in this course, and it's pharmacokinetics, pharmacotherapeutics, and pharmacodynamics. And we're going to talk about that on the next few slides. Some of these terms you can find in your textbook, your Fundamentals of Nursing. Pharmacokinetics is how does the medication get into the body, and where is the site of action? Where is it going to work? What is it going to target? And then where is it going to be metabolized and broken down? And then how are we going to excrete it out of the body? It's very important that we understand these because we have to know, are their organs functioning correctly? Are we worried about a buildup of a medication and it becomes toxic, or maybe they're not getting the medication that they do need. So understanding pharmacokinetics and understanding how these medications work once they enter the body is very important. Also knowing how quickly medications work as they enter the body, whether it's sublingual through the mouth, if it's IV through muscle, or through the skin, or if it's inhaled. So understanding everything about your medication before you give it is highly important. When we think about pharmacotherapeutics, how is this drug supposed to work? What is supposed to happen? What do I expect to see? If I have a patient who has a fever and I give them Tylenol, I expect for the fever to go down. Simple as that. But if it doesn't, or something happens, they break out in hives because I gave them aspirin, or their tongue and their throat start to swell up and have difficulty breathing, that is not what was predicted. So understanding what is supposed to happen when this patient has this medication, and then what is the desired effect, what is supposed to happen. The last exemplar is pharmacodynamics, and this is how drugs have effects on the body, what is the medical or pharmacological effect it's going to have, and then looking at how long it lasts in the body. This is so we know how often to give a medication. It's also known as the half-life. So when does this medication peak and when does it start to break down? And this helps us to know, or helps the physician to know, how often to give a med and also how much of it to give. And we want to know how long it lasts. Have you ever wondered when the doctor says take this amount every 4 hours or every 6 hours? How do they know that? Well, this is looking back at pharmacodynamics. And when we start looking at medications and you start to look into your drug or books, you'll see where they have this information in those textbooks. Here's a little bit just further information, talk about pharmacodynamics, and again, how this drug is going to affect the bodies, and when is it going to be, how much does it take to be therapeutic. Sometimes a medication can become toxic. We have certain levels of the drug that we can have in the body, and if we have too much, a patient can become toxic and have interactions to that. Again, knowing what the drug does to the body, and also how it can interact with other physiological processes the patient has going on, but also how it's going to interact with other medications or maybe even foods. Also to how the sun can affect the patient, because maybe the medication has made them sun sensitive. So this is some more information that we need to make sure that we understand when we're given medications. So when we think about pharmacology and that concept, this is the main things that should jump into your head. It's not like, oh boy, I get to give a drug or I get to give a shot. Well, that's the act of doing something with a piece of equipment, or but when we're looking at the pharmacology, we're really looking at the medication, and again, the pharmacokinetics and the therapeutics and the dynamics of the drugs. And that is your first steps that you need to make sure that you understand.